Start.
Hello,
Hello.
this is Dr. Gabra, the doctor in the outpatient clinic. Are you Mr. Drake, 78-year-old?
Yes, doctor.
Okay, nice to meet you, sir.
Nice to meet
Well,
you,
we
doctor.
are here. Thank you. Well, we are here today to discuss your condition. Is that okay with you?
Yes, doctor. I just want to know that what is happening with you.
So during our conversation, I will be writing some notes in the paper. It will be totally confidential. Is that okay with you?
Okay, doctor. I have no problem with that.
So I understand from the GB letter that you came with loss of your weight. Can you tell me more about it?
Yes, doctor. I have no intention to lose my weight, but for the last 4 months, I have noticed that I have lost a few kg weight. About 4 months ago, I was around 81. And this time, few days ago, when I measured my weight, it was about 74 kg. So I lost around 7 kg over this time. And I also noticed that I am getting much thinner. My outfits are getting uh, unfit for me. So
I'm sorry
initially,
to.
I thought that it might be due to my exercise. I started little exercise recently because I think that exercise keep my health fit. But I don't think that this will lose my weight so much. So I just wanted to be sure that is there any problem with me. And my GP said that losing this mass weight is not normal. So he sent me here for better evaluation.
Okay, we are here to help you out, and we will have a result in the end of our conversation. So the loss of weight was totally unintentional.
Yes, doctor.
And can you tell me about your appetite?
Appetite,
How
I
is your
think
appetite?
somewhat good. I have not lost so much appetite, but I think that I am eating less than before.
And you said it was started 4 months ago.
About 4 or 5 months.
And how it progressed during this time? Is it increasing, decreasing?
Yes, doctor. I think it is increasing.
Okay. Do you have any other symptom you want to tell me about it?
No, doctor, I am quite fine. I had just some issue with my lung that was diagnosed about 20 years back. And at that
Yes.
time, they diagnosed me with condition called COPD, and they prescribed inhaler for that. I was taking that. With that, I am almost fine. Just I have some cough, and sometimes I feel shortness of breath when I uh, do a lot of exercise. Otherwise, I don't have any problem.
So you think your condition with COPD is controlled? It's not progressing recently.
No, I think it is controlled.
So do you have any shortness of breath recently?
Yeah, yes, doctor. I have a shortness of breath, and when I do
Wh-
exercise, not at rest.
When you do exercise, when you are at rest, no shortness of breath.
No, when I am at rest, I don't feel any shortness of breath.
When you walk regularly, do you have shortness of breath?
No, not on regular work.
When you walk on hill upstairs, do you have any shortness of breath?
Uh, just I can remember that having heavy exercise that brings the shortness of breath. Otherwise, not.
Okay. How many do you increase your bellow during sleep recently?
No,
Do you wake up at night catching of air?
no.
Okay. Otherwise, do you have any cough?
Yes, doctor. The cough is a regular thing for me. And also
Is it?
before the diagnosis of my COPD, I had cough and my shortness of breath, and after that, the doctor diagnosed me with COPD.
Is the cough productive or unproductive? Not productive.
Yes,
Do
doctor.
you have
Sometimes I
phlegm with
produce
the cough?
phlegm.
Sorry.
Sometimes I produce phlegm.
Yeah. What color is it changed recently?
Color, I think it is somewhat whitish, and I
Whitish.
haven't.
Is the color changed recently?
No.
Is it including any blood with it?
Yes, doctor. I noticed about 3 or 4 times blood, and that was not so much, so I didn't worry for that.
Since when?
That was about for last 2 months.
And what is the amount? Do you measure the amount?
No, it was very little amount,
And how many times per day?
about 3 or 4 times over the last 2 months.
Do you have any blood anywhere else in your orifices? In your nose, in your mouth, your
No, doctor.
any other? Okay, fine. Uh, do you have any chest pain?
No,
Uh, can I ask you if you have any raised body temperature?
no,
Any lump or bump anywhere in your body?
no,
Any sweating?
no.
Any tiredness?
Yes, doctor. I feel little bit tired. I think that it might be due to my age.
And since when you have this tiredness?
That is also for last 4 or 5 months.
And do you notice any skin rash anywhere?
No,
Any joint pain?
no,
Any swelling in front of your neck?
no,
Any weather preferences?
no.
Okay, fine. Can I ask you a little bit more about other system? Do you suffer any headache?
No,
Any fits?
no,
Any weakness in any part of the body?
no, doctor.
Any numbness in your limb?
No.
And how is your mood nowadays?
I am total all time the social person, so I haven't problem with that.
Okay, fine. And how's your bowel work?
I think it is fine.
No constipation or loss of stool?
No,
Did any blood or blackish tarry stool?
no,
No abdominal pain? No tummy pain?
no,
And how's your water work?
it's fine.
Any burning pain during micturition? Any
No, doctor.
mm, any frothy in the urine?
No,
Frothiness? Do you have any racing or pacing in your heart?
no,
And you told me no chest pain.
no, sister.
Okay. Can I know if you have any previous medical history aside from COPD?
No, doctor. I just needed about 4 times admission for my um, uh, uh, sudden deterioration of my COPD. Otherwise, not.
And did you stay in the normal floor or in the ICU,
Or
in the
normal ward,
intensive
doctor.
care?
They gave me some oxygen, some injection, and after that, I get well.
And did you need any time for artificial ventilation?
No,
Okay. And you don't have other medical issue like diabetes or hypertension or asthma?
no, doctor. I am totally a quite fit person.
And can I know what your medication?
I take salbutamol and fluticasone inhaler.
And are you compliant with your
Yes, doctor. I
medication?
take those medication regularly. I take the fluticasone twice daily, and salbutamol I take when I needed this.
And do you have any oral thrush?
No,
And no sore throat. Do you gargle after you use
Yes,
the
doctor.
nebulizer? Okay. And how many times you use salbutamol as BRN?
Whenever I need, sometimes 3 or 4 times a day, sometimes 2 times a day.
Okay. Do you have any operation or hospitalization aside from COPD admission?
No, 10 minutes past.
Uh, uh, do, do you have any allergy to any medication?
No.
Mr. Drake, do you smoke?
Yes, doctor.
How many cigarettes for how many days?
Previously, I smoked a lot, doctor, but I have cut it down. And recently, I usually smoke 10 to 15 sticks a day.
And in the previous?
A pack, sometimes more than a pack.
Mr. Drake, still the smoking very dangerous for your health, especially your condition, and you need to stop smoking. If you want, I will refer you to smoking cessation clinic. It help you with your smoking cessation. Is that okay with you?
Okay, doctor. My previous doctor also advised, but I will try to stop it.
And, do you drink alcohol?
No,
What is your job?
I'm a retired person, doctor.
I'm sorry to ask this, but do you use any illicit drug?
No, never.
Do you drive, Mr. Drake?
No, doctor.
And any recent travel?
1 year back, I traveled to the USA to see my daughter.
Come again, please. When it was that?
1 year back.
1 year. Okay, fine. Uh, okay, Mr. Drake, I will summarize what I get from you so far. Mr. Drake, 78-year-old, you are suffering for a long time for the condition called COPD, and it is almost controlled. You have shortness of breath only when with exercise. You are suffering since 4 months ago from losing weight 7 kg with tiredness and cough with the blood. Otherwise, there is no lump or bump, there is no fever, and other system review was okay. Your medication, the inhaler, salbutamol, and other cortisone inhaler, and there is no side effect, and you are okay with that. Do you want to add anything?
No, doctor. This is the far I have had.
So, Mr. Drake, what is your concern for me?
Why I am losing weight, doctor? Actually, I just worried that is there is something serious.
Mr. Drake, there is uh, many possibility in my
You can
mind.
examine the patient.
Sorry,
You can examine the patient.
examination also. This
If,
is not
if,
history.
if you think it is relevant, then you can go for the examination.
Yes, I want to. Can I examine you, Mr. Drake?
Okay, doctor.
So I want to take a general look if there is any wasting, any cachexia, any muscle wasting, if there is any clubbing, any pallor, any
Clubbing
jaundice.
present.
Sorry,
Clubbing is present.
there is clubbing, there is cyanosis,
No cyanosis.
palmar erythema. How
No.
is the vital sign? Any problem with the vital sign? Respiratory rate, if there is
His
any.
pulse is 78 beats per minute. Blood pressure is 130 over 80 millimeter mercury. Respiratory rate is 14 breaths per minute.
Okay, no peripheral or central cyanosis, no pallor.
No.
Pallor
No,
there.
no sinuses. Pallor is mildly anemic.
Okay, I want to examine the chest if there is any evidence of pleural effusion or crepitation.
Dullness is percussion node dull over the left lower region.
Any lymph node there?
No,
Any organomegaly?
no,
Any increased P2, palpable P2, sign of pulmonary hypertension?
no,
Pedal edema?
no,
Okay, fine. Where we are now, I answer the concern.
no.
Concern Mr. Drake by taking history from you and by your examination. I need to rule out a serious condition that maybe it will be the reason. I want to rule out abnormal a cancer of the lung,
Why
which
cancer, doctor? I don't have any problem. Can it be a cancer?
yeah, because of your history of COPD and smoking, by your examination, there is evidence of accumulation of water in your lung and clubbing in your finger. This raise a suspicion of abnormal growth in your lung. COPD and the smoking and the age itself, it is a risk factor for the lung cancer.
Doctor, I'm extremely sorry to hear that. What are you going to do with me now?
I will answer this, but I want to ask Mr. Drake, do you have any family history of lung cancer or cancer in general?
No, doctor.
Any significant family history?
No.
Okay. So what we are going to do now, we will refer you to multidisciplinary team, the group of specialists, including the lung specialist, the oncologist, uh, the surgery, and we will do a battery of lab test and imaging for your chest, and maybe we need for your tummy and other part of the body, and maybe we need to take a piece, some fluid from your lung to test it, and maybe we need to take a piece from your tissue to study it and to confirm diagnosis. After that, if needed, we will refer you to the oncologist so he can plan in your treatment.
Okay, doctor. When are you going to do that?
Mr. Drake will do that as soon as possible. So, because early diagnosis lead for better prognosis.
Okay, doctor.
Do you have any more concerns,
I'm
sir?
up.
Okay, thank you.
Thank you. Okay, what is
I'm sorry, but I was confused. I thought only history. This one only history.
No, I told you that it will be a long case.
Maybe I don't get
Okay, what is your diagnosis?
my differential diagnosis, the top of my differential diagnosis, pleural effusion secondary to cancer. The differential will be pleural effusion secondary to. Sorry, I forgot to ask also about exposure to tuberculosis. It's one of the differential, but against that, no fever and no lumbar. Other differential, it could be secondary to pleural effusion, secondary to pneumonia, or secondary to pulmonary embolism, though that history of travel was 1 year ago.
Okay. How will you investigate him?
This patient need to be admitted. We'll do a general investigation including CBC, RFT, LFT, electrolyte, coagulation profile, inflammatory marker, and we'll do chest X-ray and CT chest, abdomen, and pelvis, if confirmed pleural effusion, we'll need to take a sample from the pleural fluid, and we'll do the we'll we'll study the cell in the fluid, the gram stain, the acid fast bacilli, cytology, and we'll do LDH, glucose, and albumin and protein, and we'll see if it is exudate or transudate. If needed, we'll do pleural tab, pleural biopsy,
Okay.
and it should be guided by ultrasound.
Okay. Suppose this is a case of carcinoma of lung, how will you manage it?
Management, including education, explaining the disease to the patient, and we refer patient to multidisciplinary team, including oncologists, pulmonologists, and the surgeon. And patient may, if will do staging according to staging. If surgical, will do surgery, and maybe he needs supportive treatment by chemotherapy and radiotherapy.
Okay. What are the positive or risk factors of carcinoma lung for this gentleman?
Again, please, positive.
What are the risk factors for carcinoma of lung?
Risk factor.
Gentleman.
Yeah. Age, smoking, COPD. If there is history of exposure to maybe occupational, previous radiation, exposure to.
Have you asked about the exposure for this gentleman?
Sorry?
Have you asked history of exposure to any certain chemicals for this gentleman?
No, I miss it. Sorry, I miss it.
Okay, that's not a problem. Okay, thank you. You have done very good. Yeah, in the history taking, you have covered almost all the questions. I cannot give you much that you have not asked. Just some points I cannot remember that if you have asked about any nausea, vomiting.
I don't.
And also, if I cannot remember that if you have asked about any recent changes in the cough, that for chronic smokers, recent changes in the cough, that is a warning sign. This patient has increased cough recently, and he is suffering more cough in the morning this time, and any changes in the production of phlegm this time, that has also increased recently, and any changes in her voice.
Well, may I add something?
Okay.
I cannot remember whether we asked about noisy chest or chest tightness now, because at times bronchiectasis or infective exacerbation of COPD should have been ruled out. I cannot remember whether Dr. Haitham asked about it.
Miss it.
You asked it. Okay. And
No,
I miss it.
yeah. And
but
cough,
I ask if there is a recent change in the condition.
and
So
for cough, he didn't ask about a lot of.
Yeah.
He didn't
Yes.
evaluated it very well.
Okay, and again, about shortness of breath. Again, any swelling in the legs, because at times pulmonary hypertension can also develop.
He asked swelling in the legs.
Yes. So he asked,
Yes.
and then about if he's suspect, if malignancy is suspected, whether about the complications, any changes in voice, any flushing of the face, or any pain in the wrists, is these questions important for complications like dysphagia, hoarseness of voice, or hypertrophic pulmonary osteoarthritis?
He asked about the joint pain,
But not specifically joint pain. About wrist pain, I think, is it important or not? I'm just asking. Any changes in voice, hoarseness, any flushing of faces recently, or any redness in the faces recently? Is those important because of the complications? or any kidney numbness in the hand.
For carcinoid syndrome, that is, I think, would be related to the gastrointestinal symptom. This was
No,
not.
I think HBCO can be involved. Superior vena cava obstruction.
Okay. That is an yes, that is an option, but since he could have asked it that is there any changes in the appearance of face, or facial appearance.
Yes, and whether a PET history was asked, although it's not very much important, I guess, in this patient.
No,
but
I am coming that about
Okay.
in the present history, he haven't evaluated the cup very well. Any changes in the cup recently, and for film production, how much film production has there been any change recently? And asked about the bleeding, blood in it, and haven't asked about if it is mixed blood or altered blood, fresh blood or altered blood. Did anything make the cup worse or better? Any timing of the cup when it is worse? And after that, past history he asked it well, drug history asked it well, family history he missed, and later asked personal history, didn't ask about pet. For respiratory cases, we ask about pet and housing. And also any support. He haven't asked about if the patient needs any support, and also for occupation, he's a retired person, but what did he do in the past? He haven't asked it.
Yes, important.
Okay, otherwise everything was fine.
So what was the case actually?
Carcinoma of the lung.
Okay.
And for the differential diagnosis, bronchiectasis is the differential diagnosis. Okay. Bronchiectasis, chronic heart failure, chronic pulmonary embolism, all of them are possibility for scarf, with placenta, idiopathic pulmonary fibrosis. All these are possibility, but as there was physical examination, this brought that the diagnosis could be possibly carcinoma of the lung, complicating pleural effusion or any mass lesion.
Okay.
Okay.
Yeah.
Want to add anything, or I will end this session?
I think you can stop this discussion. Dr.